Chapter 16, Endocrine System. In the endocrine system, we're going to pronounce organs and anatomical structures and define the word parts related to the system. We're also going to define and pronounce the disease and disorder terms and the surgical terms for the endocrine system. This graphic shows the endocrine system and the different structures that are a part of the system. And as you can see, this pretty much covers the body as a whole in different sections. We also see in this view the body structures, the organs that produce hormones, but we also see the specific hormones that are produced in each of the organs. So let's look at some combining terms for the anatomical structures. Adrenal glands is adreno or adrenal. Cortex is cortico. Endocrine is endrinico. Parathyroid glands are parathyroido. Pituitary glands is pituitario. And thyroid gland is thyroido, excuse me. These are obviously pretty close to the full term, so hopefully that'll make it a little bit easier in this section. Some more terms are acro, which means extremities or height. Calci is calcium. Dipso is thirst. Kali is potassium. And natro is sodium. Some prefixes are U, and this is pronounced as if it were one letter. Hyper, which means excessive or above. Hypo, which is kind of the opposite, is below, deficient, incomplete, or under. Pan means all or total. Poly means much or many. And syn means together or joined. Some suffixes are drome, which means run or running, and typically it's used with quite often with the last prefix we looked at, which was syn, so that makes it a syndrome. And a lot of times this is a disorder where a number of symptoms are running together, and that's how they define it before it's actually a actual diagnostic term. Emia means in the blood. Ism is state of. Oma is a tumor or swelling. Amplasia is a condition of formation, development, or growth. Disease and disorder terms. Acromegaly means enlargement of the extremities, and this is usually because of an overproduction or excessive production of growth hormone from the pituitary gland. Hypercalcemia is excessive calcium in the blood. Hyperkalemia is excessive potassium in the blood. Hyponatremia is a deficient amount of sodium in the blood. Hypothyroidism is a deficient amount of thyroid gland production. And panhypopituitaryism is total, that's our pan, and then a deficient pituitary gland activity, which decreases production. The first of the disease and disorder terms is Addison disease, which is a chronic syndrome that is caused by deficiency in hormone secretion in the adrenal cortex. Then we have Cushing syndrome, which is a group of signs and symptoms that result from the excessive production of cortisol by the adrenal cortex. Sometimes this may be due to a tumor in the pituitary. Some of the signs and symptoms are pretty classic with this. You might see a moon face, which is a very rounded, obviously distorted, rounded face shape. And then fat pads developing on the chest and the abdomen, and then a buffalo hump near the top of the back or below the neck. It would also be referred to as the buffalo hump. Diabetes mellitus is a chronic disease caused from carbohydrate metabolism error or problem. It's basically being underactive in producing insulin from the islets of Langerhans in the pancreas. And as a result of all of that, it allows the blood glucose to elevate. Graves' disease is an autoimmune disorder, and it relates to the thyroid gland, and it's because of production of more thyroid hormone than the body needs. So that would define that as a hyperthyroidism. Pheochromocytoma, is a tumor of the adrenal medulla, usually not malignant. With this, they will quite often be hypertensive, have headaches, palpitations, diaphoresis, which is sweating, abdominal pain, and the treatment for this is going to be removal of the tumor itself. Some surgical terms is adrenalectomy, and this is excision of one or both of the adrenal glands. Parathyroidectomy, this is the excision of one or more parathyroid glands. And then thyroidectomy is excision of the thyroid. In section 2, we're going to define and pronounce diagnostic terms and complementary terms of the endocrine system. In section 2, we're going to interpret the meaning of abbreviations and to apply the medical language in a clinical context as a clinical notation. Okay, some diagnostic terms are fasting blood sugar, which is very commonly referred to as an FBS. This is a blood test to determine the amount of glucose in the blood. A glycosylated hemoglobin. It's a blood test that measures the amount of glucose that's attached to the hemoglobin, the red blood cell. The radioactive iodine uptake is a nuclear scan that measures the thyroid function. Systemic parathyroid scan is a nuclear procedure to localize the hyperactive parathyroid glands. And the thyroxine level is a blood test to measure the amount of thyroxine in the blood. Complementary terms are adrenocortical hyperplasia, which is excessive development of the adrenal cortex. Exophthalmos is abnormal protrusion of the eyeball. A goiter is enlargement of the thyroid gland. Polydipsia is an abnormal state of much thirst. It's a common symptom that will be mentioned for diabetics. And tetany is a condition affecting the nerves and causes causes muscle spasms. And this is because of a low calcium due to parathyroid hormone insufficiency. Some abbreviations that we will see in the endocrine system, and these are all pretty common. The ADH is antidiuretic hormone. The DI means diabetes insipidus. It's not technically what we refer to as diabetes. There are some similar signs and symptoms, but it has a different cause. FSH is follicle stimulating hormone. And a RAIU is a radioactive iodine uptake. And TSH is looking at thyroid stimulating hormone. Okay, now we're going to look at again the pronunciation of terms as it applies to a medical report. And you need to read along with me, but at the same time, once we're finished, take all of the highlighted terms and define them out, and then you should know this section fairly well. So, pronouncing medical terms in use. A 65-year-old female patient presented to her doctor because of a 10-pound weight gain, fatigue, hair loss, dry skin, and cold intolerance. She was referred to an endocrinologist who established a diagnosis of hypothyroidism after testing results indicated an elevated thyroid stimulating hormone and a low thyroxine level. Approximately 20 years ago, she had a painless thyroid nodule. At that time, thyroid sonography and fine needle aspiration were performed. A diagnosis of thyroid cancer was confirmed, but it had not spread beyond the gland. She underwent a thyroidectomy and received thyroid hormone replacement therapy. She remained in a euthyroid state until she stopped taking the medication 6 months ago. Consequently, she became hypothyroid and could have easily developed myasthenia if she had not sought treatment.